This is your dead bug progressions. You're going to lay flat on your back. Make sure the abdomen is flush and the back is flat on the ground. You're going to keep the small of your back on the ground the whole entire time during this exercise. Reach your opposite arm and opposite leg out from one another. The further you reach that heel out and tap the floor, the harder the exercise becomes. The closer you tap the heel to the butt, the easier the exercise becomes. Once this exercise becomes easy and you can perform it without much challenge for a desired number of reps, then we'll increase the challenge by putting the feet up towards the ceiling, and you're going to notice a lot more tension through the hamstrings, through the abdominals, and we're creating longer lever arms by performing the dead bug with straight leg raised the entire time. Same thing, keeping that small of the back flat on the ground, abdomen flush with one another, and lowering the legs, tapping the heel to the ground. Now, depending on your rep range that you're doing, you can start with the most advanced version and do as many reps until you fail, and then finish out the remainder of the desired reps that are listed on the workout by making the exercise easier. So you're always welcome to start with the more challenging version and then do as many as you can, and then finish out the desired number of reps or the listed number of reps on the workout by finishing with the easier version of the dead bug. And again, we can progressively make this easier by bringing the heel in towards the butt. Now, one common complaint of this exercise is if an individual gets a snapping sensation rolling over their tendon rolling over top of a bone. This is commonly referred to as the snapping hip syndrome. Don't be freaked out by the name. It's not dangerous whatsoever. It's not going to cause a problem. One of the reasons people get this is because when they try to flatten their back out on the ground, they over bear down, almost like they're doing an abdominal crunch. It should be a very subtle motion to flatten the back out on the ground with very minimal ab tension, as well as you don't want your sternum coming towards your thighs. So your sternum should stay up proud. This is not an abdominal crunch. We're not trying to use the rectus abdominis for this exercise. We're trying to utilize your obliques and your transverse abdominis. So when you crunch the exercise and you bear down on the exercise, sometimes that will cause the snapping to occur. What you'll also notice when you do this correctly, again, your abs should not have the most tension in the world. There's going to be a subtle amount of tension. Your chest and your belly button are going to be up proud towards the ceiling. Your back will still be flat on the ground. There won't be an excessive arch, but the leg that is up towards the ceiling, you're going to feel a little bit more pressure on the floor on the back side. The leg that is moving out away from your body, you're going to feel a slight amount of arching occurring in the back on that side. And that's perfectly normal, and that's just because we're trying to dissociate the pelvis and the hips. They're doing opposing movements while you do this. Again, nothing's bad is going to happen to your tendon. This isn't a problem. It's a common complaint that many people have, and it doesn't lead to issues. But a lot of times just, again, getting the position right of the pelvis and then thinking about pulling your leg down to the floor, not lowering the leg down to the floor. That is another key. That helps you feel your glutes and your hamstrings pull the leg down like you're doing a leg press in this instance, or pulling your heel down towards the floor with the longer lever arm with the feet straight up towards the ceiling. That will help engage the right musculature to kind of keep the snapping symptoms at bay for you. There's other things that we do in the Sports Rehab Expert workout programs that works your hip flexors, works your abdominal regions, works your flexibility, and works your abdominals, which will help these symptoms reduce and become less prevalent over time. So be sure to be working on those simultaneously, as well as if it's just an irritant for you and you can't avoid that snapping sensation, then just don't take your leg out quite as far away from your body. The closer you bring your heel in to you, the less tension is being placed on the rectus femoris. That's another thing. Making sure you have adequate flexibility through the rectus femoris is important to make sure that you don't get these symptoms. But that's a way of, again, just avoiding the snapping sensation altogether while you spend time working on some of these other qualities that will help reduce the snapping sensation overall for you too. So don't let it be a barrier for you trying to do the exercise. Again, you can modify this exercise in many different ways. If you have questions, feel free to reach out to me at greg@sportsrehabexpert.com, and I will help you out and give you more direction and clarity on the workout program as you perform this exercise.